Autism is a disorder that affects communication, social interactions, and behavior. It is a spectrum disorder, meaning that it has a range of severity and symptoms. According to recent statistics, autism is on the rise worldwide, and it is becoming more prevalent in both developed and developing countries. In this video, we will explore the factors contributing to the increased prevalence of autism, the challenges of diagnosing and treating the disorder, and what can be done to address this growing health concern. The rising prevalence of autism. The prevalence of autism has increased dramatically in recent years. According to the Centers for Disease Control and Prevention, in the United States, the prevalence of autism spectrum disorder among children aged between 8 years old has risen from 1 in 150 in 2000 to 1 in 54 in 2020. Autism is a worldwide phenomenon, and it is on the rise in other countries as well. In the United Kingdom, the National Autistic Society reports that the number of people diagnosed with autism has increased tenfold in the last decade. Why is autism on the rise? The increase in the prevalence of autism has led to numerous debates and discussions among researchers, clinicians, and the general public concerning the reasons behind the trend. Several factors, including genetic and environmental factors, have been proposed to be associated with the rise of autism. Genetic factors. Many researchers have suggested that genetics plays a significant role in the development of autism. Studies have found that autism tends to run in families and is more common among siblings of people with autism. Autism is caused by a combination of genes, and certain gene mutations have been linked to autism. However, while genetic factors undoubtedly play a role in autism, it doesn't entirely explain the increase in autism diagnoses. Environmental factors. Environmental factors such as prenatal, perinatal, and postnatal exposures have also been found to contribute to the rise of autism. A study published in the Journal of Autism and Developmental Disorders has found that prenatal exposure to environmental toxins such as organophosphate pesticides, mercury, and polychlorinated biphenyls increases the risk of autism. Other studies have linked maternal exposures to phthalate, flame retardants, and air pollution during pregnancy to the development of autism. Still, other researchers have suggested that vaccines and their preservatives like thimerosal or aluminum adjuvants could cause autism. Still, these claims have been repeatedly debunked, and there is no scientific evidence that supports the idea that vaccines cause autism. Diagnosis challenges. The increase in the prevalence of autism can also be attributed to a heightened awareness and improved screening and diagnostic tools. Early interventions for autism have been shown to be more effective when initiated at an early age, and this has led to more efforts to identify children with autism at an early stage. However, diagnosing autism is not a straightforward process. Autism is a spectrum disorder, and its symptoms can vary widely from person to person. Due to the lack of a biological test for autism, diagnosis relies on behavioral observations and assessments, which can be subjective. In some cases, mild autism can be overlooked or misdiagnosed as other conditions such as anxiety, depression, or attention deficit, hyperactivity disorder. Conversely, some children may receive a diagnosis of autism when they do not have the disorder. Treatment challenges. Autism is a complex disorder that requires specialized treatment and care. Treatment aims to help people with autism develop social communication skills, manage behavior problems, and improve their ability to interact with others. However, obtaining specialized care for people with autism can be challenging, especially in developing countries where resources and facilities are limited. Moreover, there is no single treatment for autism since each person with the disorder is unique. Therefore, treatment is often individualized, and an intervention that works for one person with autism may not work for another. Therefore, identifying and implementing effective treatment options for autism is challenging. Moreover, many treatments for autism are costly, and health insurance coverage for autism is limited in many parts of the world, making it difficult for families of people with autism to obtain necessary care. What can be done to address the rise of autism? The rise of autism is a global health concern that requires a concerted effort from policymakers, researchers, clinicians, advocates, parents, and communities to address. Here are some ways to tackle the issue. Increase awareness. There is a need to increase public awareness about autism, its symptoms, and treatment options to reduce the stigma associated with the disorder and encourage early screening and diagnosis. Improve diagnosis. Healthcare providers need to have access to improved diagnostic tools and screening protocols that allow for early and more accurate diagnosis of autism. Enhance education and training. Healthcare providers such as physicians, nurses, psychologists, and social workers need education and training on how to recognize and manage autism effectively. Nominate insurance coverage. Health insurance providers should be mandated to cover the cost of interventions and treatments for autism and extend coverage to the entire spectrum of care, including diagnosis, behavioral interventions, and support for parents and caregivers. Invest in research. More research is required to understand the causes of autism fully, improve diagnostic tools, and identify new and effective treatments that work for a wide range of people with autism. Conclusion. The rise of autism is a growing public health concern that requires immediate attention from policymakers, researchers, clinicians, advocates, parents, and communities. While the factors contributing to autism's rise are complex, a concerted effort to increase public awareness, improve diagnosis, enhance education and training, improve insurance coverage, and invest in research can help address the issue effectively. By working together, we can ensure that people with autism receive the care and support they need to achieve their full potential.